Hello, coders. Good morning, good evening, good afternoon, all depending upon where you're joining us from. Welcome back to another session of CPT Guideline Mastery Sessions with AMCI. How are you all doing, coders? Let me know in the chat. Let me know in the chat who all are joining with us today. We have Patty, hi, Letty, Amadou, hi, Miss Moose. Hi, Star Wars girl. Hi, Catherine. All right. Okay. So we have a few students joining here. Okay. Thank you for letting me know, Miss Mills. Okay. So I hope you all are feeling energized, focused, and ready to level up your coding skills today. Hi, Starry Sunny. Hi, Miss Veena. Okay. Hi, Jack. All right. Now, Codes. So, the topics we are covering today may not have a lot of detailed guideline associated with it, but it is one of the most frequently tested topics on the board exams. And the best part is that once you understand the logic, these are some of the easiest points you can score. So, today we are going to break it down step by step, and by the end of the session you will be feeling much confident. All right. Okay, so let's not waste much time. Let's get started. First of all, let me read out the copyright. CPT Copyright 2026, American Medical Association, all right reserved. CPC is a registered trademark of AAPC. AAPC content found within this presentation is a copyright of AAPC. The keyword concept, the FTR, the churn, AMCI FAB 7, AMCI ICD 10, Flip Tab, and MCG are the trademark of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCA do not own right to these credentials. The credentials CCA, CCS, CCSP, RHIA, RHIT are owned by AHIMA. AMCA do not own right to these credentials. Okay, so Godas, before we start today's session, I want to gently remind you all that I would like to request to all you, please take a moment to fill out the survey form once the session is over, and let us know how you feel about the session, because we usually have a great attendance during our live classes, and we also have a lot of interactions in the chat, but we don't receive enough survey submissions, and your feedback really help us to improve and bring you better sessions. So the best part is it will take just less than a minute. So please make sure you fill out the survey form towards the end of the session. And thank you in advance. All right. Okay. Now today we are going to take the session. We are going to dive into the topic that may look simple on the surface, but trust me, this is where a lot of coders lose easy marks on the exam. So I'm talking about the circumcision procedures and the hysterectomy coding. All right. Okay. Hi, Oceanus. Okay, glad to know that you are on this topic. Hi, Zombie Girl. So we have few students joining here today. Okay, welcome everyone. Welcome. Okay, so before we dive deeper into the hysterectomy and circumcision coders, let's take a step back and let's understand where these codes are exactly located in your CPT manual. So the circumcision procedures, you will find them under the male genital system, and specifically you will find under the procedures performed in the penis and under the excision section. All right. And for the hysterectomy procedure, you will find them in the female genital system, and specifically the procedures performed on the corpus uteri. There is a subsection which is known as hysterectomy procedure, and that's where you will find them. So let's begin the session with the hysterectomy coding. And now when it comes to the CPT, hysterectomy procedures are primarily reported from the codes 58150 to 58294 code range. All right. And yes, so before we start talking about the coding, let's take a step back and understand the procedure in a simple, practical way. So what is a hysterectomy procedure? A hysterectomy is a surgical removal of the uterus, and in most cases it also includes a removal of the cervix. Now, depending upon why the surgery is done, surgeon may also remove the surrounding structures like the fallopian tubes and the ovaries. And this is exactly where things starts to matter for us as coders, because not all the hysterectomy procedures are the same. So in the real world scenario, the surgeon might remove different structures and uses different approaches, and sometimes also perform additional procedures along with it. So let's walk through the main types of hysterectomy we'll come across. First you will have First you have the total hysterectomy, and this is where both the uterus and the cervix is removed. Okay, and this is one of the most common type you will see. And sometimes the surgeon also goes a step further, and along with the uterus and cervix, surgeon also removes the fallopian tubes and the ovaries. So you can see the fallopian tubes, and let me take the highlighter so you can see these are the fallopian tubes and the ovaries. Sometimes surgeon also remove the fallopian tubes along with the ovaries when a hysterectomy procedure is done. So that's what we call a total hysterectomy with bilateral salpingio-oophorectomy. So salpingio means, or it's another word for the fallopian tubes, and oophorectomy means the removal of the ovaries. So salpingio-oophorectomy means when fallopian tubes and ovaries are removed together, you will call them salpingio or oophorectomy. Okay. All right. Now, in another case, cervix is actually the third type of the hysterectomy procedure, where the cervix will be left behind, and only upper portion of the uterus will be removed. Now, this type of hysterectomy is called as supracervical hysterectomy, or other term is subtotal hysterectomy. So this is not a total hysterectomy; it's a subtotal hysterectomy, and only upper portion of the, or upper third of the uterus will be removed. Okay, now we have the fourth type, and this is a most complex case, and it is usually done for the malignancy cases. So it involves not just the removal of the uterus. Surgeon may also remove the surrounding tissues, the lymph nodes, and sometimes additional structures depending upon how extensive the disease is. And that's what we refer to as radical hysterectomy with bilateral salpingio-oophorectomy. So these are the different types of hysterectomy procedures. So from coding perspective, the hysterectomy procedures in your CPT manual are primarily classified based on the surgical approach. So we have three types of approaches. One is your abdominal approach, the other one is vaginal approach, and third one is your laparoscopic approach. So your CPT codes are classified based on these approaches. So first let's zoom into the abdominal approach. And in this type of hysterectomy, the surgeon removes the uterus through the incision made in the abdomen. And this procedure is usually selected when the uterus is large, or sometimes in the cases involving the fibroids or cancer or suspicion of malignancy. That's when you go for an abdominal approach. And abdominal hysterectomy procedures are open surgery. All right. And next we have the vaginal approach, the second one. In a vaginal hysterectomy, the uterus is removed through the vaginal canal. And that means that there will be no visible incision in the abdomen. Then we have the third type, that is laparoscopic approach. So in the laparoscopic approach, surgeon will remove the uterus by small incisions in the abdomen with the help of camera, which is known as laparoscope. So instead of making one large open incision, surgeon will work through keyhole incisions, which is using specialized instrument. Okay, so this is a minimally invasive approach, the laparoscopic approach. Okay, so whenever you read a hysterectomy question, don't rush into the answers right away. Take a moment, pause, and first ask yourself this question: how was the procedure performed, or what was the approach? Because if you identify the approach, the coding process becomes much easier. And if you look into this slide, you can see that abdominal approach is further subclassified, or the codes are subclassified based on the extent and complexity of the procedure. While for the vaginal and laparoscopic approach, they are further classified based on number one, weight of the uterus. So we will be talking about them in the upcoming slides. And in laparoscopic approach, we will have to also identify the type of the hysterectomy performed along the weight of the uterus. Okay, so this is a three type of approach. I hope it is clear. Let me know in the chat code is if you're good so far. If you're good so far, okay, please type in the chat. And okay, so I will move on to the next slide, and let's zoom into the abdominal approach hysterectomy coding. So when you see the abdominal hysterectomy in a question, okay, thank you for letting me know. So when you see an abdominal hysterectomy in a question, you already know that the uterus is being removed through open abdominal incision, right? So at that point, your focus should be something else. Yes, your focus should shift to something else, because within the abdominal category, the codes are classified not based on the weight of the uterus. They are classified based on the extent and complexity of the surgery. So if a standard removal of the uterus and cervix is done with or without removal of the tubes and ovaries, then you will be looking at a total abdominal hysterectomy, and the CPT code will be used. That will be 58150. All right. Now, if the cervix is not removed and only the upper portion of the uterus is taken out, that becomes a supracervical or subtotal hysterectomy, and the code used would be 58150. Then you might see the cases where the procedure is a bit more extensive. For example, hysterectomy performed along with a partial vaginectomy. And that's where you would use CPT code 58200. We also have a code 58210 that is much more complex, and that is done for cases of malignancy where the patient comes or patients having malignancy, and that is a radical abdominal hysterectomy procedure. So that involves a removal of the uterus, cervix, and lymph nodes, also the surrounding tissues as well. All right. So one more code is there under the abdominal hysterectomy, that is 58240, and that is the most complex surgical procedure under the abdominal approach, and that is for pelvic extenuation. So pelvic extenuation is a radical complex surgical procedure which is used to treat advanced or recurrent pelvic cancer. And in this procedure, you will see that it involves removal of multiple organs such as a bladder, parts of the bowel requiring colostomy, etc. So when you see removal of multiple organs, that would code for a abdominal that would code for a pelvic extenuation procedure. All right, so these are the procedure under the abdominal hysterectomy. Let's move on to the next slide, and let's move on to the vaginal approach. So in vaginal approach, things starts to look a little bit different compared to the abdominal hysterectomy, because coding here or the codes here are not driven by the complexity. First thing you have to focus is the weight of the uterus. So under the vaginal approach, you will see the codes are classified into two groups. In one group, where the uterus weight will be equal to or less than 250 gram, and the other group where the uterus weight will be equal to, not equal to, it will be greater than 250 grams. Okay, so these are the two classification. Now once you identify the weight, everything will becomes a pattern. So let's look at both side by side, so you can clearly see the logics. So if the uterus weight is equal to or less than 250 gram and a vaginal hysterectomy is performed, you would use the code 58260. Okay, and if the weight of the uterus is greater than 250 grams, then you would use the code 58290. Similarly, If a removal of the tubes, fallopian tubes and ovary is performed, then you will use the CPT code 58262 and 58291. And if the removal of the tubes and ovaries is performed along with the repair of the enterocyl, you would use 58263 and 58292. So if the vaginal hysterectomy is performed along with the repair of enterocyl, then you would use code 58270 and 58294. And both these sets are classified or differentiated based on the weight of the uterus. Okay, so that is how you will chun your manual. So chunning is very important in this section. So if you have chun your CPT manual, that would be very, you would find or you would pick the codes easily. All right. Okay, now there are few more codes in addition to these codes which you will come across the vaginal hysterectomy. For example, if a vaginectomy is performed along with the hysterectomy, you would use the CPT code 58275. And if a vaginectomy is performed along with the enterocyl repair, then you would use 58280. And in rare cases involving malignancy, you may also use a radical vaginal hysterectomy code, that is 58285. Okay, so this is about the vaginal hysterectomy. And let's move on to the third approach, that is laparoscopic approach. So just like vaginal hysterectomy, weight still matters here, but we are adding one more layer. So we also have to identify the type of hysterectomy performed during the laparoscopic approach. So again, I will break this down. You can see the codes are first classified based on the type of hysterectomy. So you have CPT code 58570 to 58573. These are for total laparoscopic surgical total hysterectomy, and these two groups are classified depending upon the weight of the uterus. Okay, so you have code 58570, which is used for laparoscopy surgical with total hysterectomy, and that is the same code 58 sorry you have code 58572 that is used for laparoscopic surgical total hysterectomy. So the difference between these two code is that 58570 is for equal to is used when the uterus weight is equal to or less than 250 gram, and 58572 is used when the uterus weight is greater than 250 gram. Again, you have codes 58571 and 58573 if the tube and or the ovaries are removed. Yes, so these codes are again classified based on the weight of the uterus. And next we have codes for, yes, we have codes for laparoscopy surgical supracervical hysterectomy. Again, these are classified, again subclassified based on the weight of the uterus. All right. And third classification of the laparoscopic hysterectomy code is where the laparoscopic surgical with vaginal hysterectomy. So here actually the procedure starts laparoscopically, but the uterus will be removed vaginally. So there's a combination of approach used. The procedure starts laparoscopically. Along with that, we will have vaginal hysterectomy as well. Okay. So once again, the codes are subclassified based on the weight of the uterus. All right. So finally, we have few more codes left under the laparoscopic hysterectomy. We have 58548, which is used for laparoscopic radical hysterectomy, and we have 58575 that is used for a much more complex procedure, that is a tumor debulking procedure. All right, so that's a keyword. So when you see a tumor debulking, you would use 58575. And one more code is there under laparoscopic hysterectomy, which is an add-on code. So this actually not falls under a laparoscopic hysterectomy. This is for a subtotal or total hysterectomy that is to be used after a cesarean delivery. So this is an add-on code, and this add-on code should be used along or it should be used only when a hysterectomy is performed after a cesarean delivery. And the parenthetical guideline, you can see which all codes you can use this code along with. Okay, so that's all about the hysterectomy procedure, and I will just summarize what we have seen or what we have learned so far. So while coding the hysterectomy procedure, first thing which should come to your mind, or first thing which you should note, is the approach. Identify the approach. Identify whether it's an abdominal approach, vaginal approach, or laparoscopic approach. If it is an abdominal approach, the codes are further classified based on the extent and complexity of the procedure. If it is a abdominal, if it's a vaginal or laparoscopic approach, in vaginal approach, codes are further classified based on the weight of the uterus. While in laparoscopic approach, you have to use or you have to think about 2 points. One, the type of the procedure. Second is the weight of the uterus. Okay, and also keep in mind or focus on what all procedures were performed along with the hysterectomy procedure, whether there was a fallopian tube removal done, whether there was an enterocyl repair performed, etc. All right, are we good so far, coders? Let me know the chat, because we are going to move on to some coding exercise. Are we good? Are you ready for some coding exercise? Awesome. Okay, so let's begin. And here is your first exercise for the day. Of the following answers, which best describe the correct CPT coding for this procedure? Option A, 58571. Option B, 58180. Option C, 58150. Option D, 58262. A 48-year-old female presents for the surgery due to severe symptomatic uterine fibroids. The surgeon performs total abdominal hysterectomy, removing both the corpus and cervix through an open abdominal incision. Both fallopian tubes and ovaries are also removed during the procedure. Pathology reports notes the uterus weight 220 grams. Of the following answers, which best describe the correct CPT coding for this procedure? And your time begins now, coder. So remember, first identify the approach and then select the code. All right, great. Type your answers in the chat. All right, that is time. I can see few answers in the chat, and there was question regarding the 16-week YouTube course, and you will find the playbacks in the YouTube IMCA YouTube channel. All right, so please follow the syllabus. I think there will be a link for the playlist in the syllabus as well. Okay, so you can find it there. All right, so okay, good answer so far. Let's go ahead and let's solve this one. So we have in inventory, total abdominal hysterectomy was performed. Fallopian tubes and ovaries were removed. That's important. Uterus size was 220 gram. All right. So first thing to note is that what was the approach here? And from the inventory, I can see it was a total abdominal hysterectomy. So abdominal approach was used here. And CPT code 58262, that is coding for vaginal hysterectomy. We didn't have a vaginal approach. It was abdominal approach and abdominal hysterectomy. So I can say option D is wrong because of that. Now let's look into the next one, 58571, which is for a laparoscopic surgical total hysterectomy. Once again, we didn't had a laparoscopic surgical procedure here. It was a total abdominal hysterectomy, and as I said, abdominal hysterectomy, it's an open procedure or open surgery, and it's not a laparoscopic surgery. And that makes option A also incorrect. We are left with just two options, B and C. Option B is coding for 58180, that is for supracervical abdominal hysterectomy, and 58150 is coding for a total abdominal hysterectomy with or without removal of the tubes, with or without removal of the ovaries. Okay, now I would say option B is incorrect because option B is coding for a subtotal hysterectomy, not for a total abdominal hysterectomy. And we had a total abdominal hysterectomy performed in our scenario, and that makes option C the right answer. Okay, so option C is going to be the correct answer for this scenario, and I hope the explanation helped. Please let me know if you have any questions. Okay, so we'll move on to the next one. Great job, coders. Excellent job. Let's move on to the next one. Second question. Of the following answers, which best describe the correct CPT coding for this procedure? Option A, 58294. Option B, 58280. Option C, 58290. 57268 with a 59 modifier. Option D, 58292. A 55-year-old female presents with chronic pelvic pain and symptomatic uterine fibroids. After failure of conservative management, she is scheduled for a vaginal hysterectomy. During the procedure, uterus is removed vaginally. The surgeon notes incidental enterocyl, which is repaired during the same session. The fallopian tubes and ovaries are visualized but intentionally left intact. Specimens sent to the pathology, and the final report documents uterus weight 310 grams. Of the following answers, which best describe the correct CPT coding procedure? All right, coders, all the best. Your time begins now. Okay, A is the answer which I see in the chat. I can see any other alphabets than alphabet A. So A for amazing, right? So you all are doing an amazing job. Excellent job, coders. Okay, so let's solve this one. Great job, great job. Okay, so there was a question regarding the whether you can carry on your own manual for the exam. It totally depends upon which region you're taking the exam from. So in the states, I believe you can or you need to take your own books. So make sure you confirm with the relevant authorities. Okay, so if you have a proctor, you must have a contact of the proctor. So contact with the proctor and make sure whether you can take your manual or will they provide them. All right. Okay. I hope the answer helps. So what we having here? We have a vaginal hysterectomy performed, and the weight of the uterus was 310 grams. So this is very important, right? Because as I said, the vaginal hysterectomy codes are further subclassified based on the weight of the uterus removed. And there was also an additional procedure done, that is enterosil repair. That is also something which you have to keep in mind. So let's look into the codes. 58280, that is coding for a vaginal hysterectomy. But if you read the code language completely, you will see that it includes a total or partial vaginectomy. Now, nowhere in the document it mentioned that we had a partial vaginectomy. So option B is wrong. And next one is 58292, which is for vaginal hysterectomy with removal of the tubes and ovaries. Now, this is for vaginal hysterectomy for the uterus that is greater than 250 gram. That part is correct. But did we had a removal of tubes and for ovaries? No, the documentation clearly stated that the fallopian tubes and the ovaries are visualized but intentionally left intact. That means they were not removed, and that makes option D incorrect as well. We're left with option A and C. Option C is coding for 58290, that is for vaginal hysterectomy for uterus greater than 250 gram. Again, that portion is correct. Also, 57268, that is for repair of an enterosil vaginal approach. Now, we did had an enterosil repair performed as well, but you can see that 57268 is a separate procedure, and we do have a combination code for vaginal hysterectomy with an enterosil repair, and that is coded with 58294. So 58294 is for a vaginal hysterectomy for uterus greater than 250 grams with repair of the enterosil. So this was not a separate procedure, right? So you don't need to code them separately. If you code them, that is unbundling. So we have a combination code here, and you have to code the combination code for such scenarios. And that makes option A 58294 the correct one. Okay, so all those who said A, great job. Excellent. So let's move on to the next one. All right, Curtis, you're doing a good job. The third question is here. Of the following answers, which best describe the CPT coding for the procedure? Option A 58260, option B 58552, option C 58553, option D 58550. A 45-year-old male patient presents with abnormal uterine bleeding, unresponsive to medical management. After counseling, the patient elects to undergo surgical treatment. The procedure is initiated with laparoscopic approach, during which the uterus is mobilized and surrounding structures are evaluated. The fallopian tubes and ovaries are visualized and preserved. The surgery is then completed via vaginal approach and uterus is removed. No additional procedures performed. The specimen sent to pathology, which confirms the uterus weight as 215 grams. Of the following answers, which best describe the correct CPT coding for this procedure? And coders, your time begins now. All right. So once again, I can see some excellent answers in the chat. Let's go ahead. So here we have in inventory, we have a laparoscopic plus vaginal hysterectomy, right? So this was, as I said, this was a third type, the laparoscopic approach, but it involved a vaginal hysterectomy as well. So this was a combination of a laparoscopic approach along with a vaginal hysterectomy. And the weight of the uterus in our scenario was 215 grams. Now let's have a look into the codes which we have. Option 58260, that is option A, is coding for vaginal hysterectomy only. We had a laparoscopic approach with a vaginal hysterectomy, so this is wrong. Okay, so the approach is wrong. That's why I said identify the approach first. Okay, that will help you a lot in eliminating the wrong answers. Now let's look into the next code, 58553. That is for laparoscopy surgical with vaginal hysterectomy for uterus greater than 250 gram. Now that's a high part we have to focus on. The uterus greater than 250 gram. The uterus weight in our scenario was 215 grams, not 250 grams or greater. So which makes option 58553 incorrect. Option C has to go. Option B is coding for a laparoscopy surgical with vaginal hysterectomy for uterus 250 grams or less. So far so good, with removal of the tubes and ovaries. Now, was a removal of a fallopian tubes or ovary performed? No, they were preserved in our scenario. So that makes option B also incorrect. The correct answer, as everyone said, is 58550. That is for laparoscopic surgical with vaginal hysterectomy for uterus 250 grams or less. Okay, so how are you all doing, Codis? How are you all doing? I can see you rocked it in the chat. So don't forget to your uh, chun your CPT manual, especially for those hysterectomy procedure. Okay. All right. So with that, we are moving on to the next topic for the day, and that is circumcision. So what is exactly circumcision? A circumcision is simply a procedure where the foreskin, also known as prepuce, is removed from the penis. And now clinically, that sounds straightforward, but from a coding perspective, there are few small details that make a big difference. So circumcision coding, I think we have for the primary circumcision, we have only three codes, but that is one area where students can easily uh, get a wrong answer, or they may easily lose the points for the exam. So I would always say to my coders that be forensic. These are easy pickings, and there are also great chance that you will get it wrong as well. So it's very important to understand the logic behind selecting the codes. All right, so the procedure is very commonly done in newborns, but it is not actually limited to the newborns. We also see them in children's and even in adults depending upon the situation. So in terms of how it's performed, it is usually done under the anesthesia, sometimes general anesthesia for small babies, sometimes even without anesthesias. So circumcision is done due to multiple reasons, like maybe due to actual clinical conditions like phimosis or recurrent infection or even urinary issues. And in many cases, it is also performed due to cultural and religious practices. And sometimes it is done as a preventive measure as well. Okay, since it helps to reduce the risk of infections like UTI or some STIs, right? Okay, so let's move on to the coding part. So circumcision procedures can be performed by using two methods. So in medical coding as well, you will see the codes are classified based on these two methods. One is by using clamps or device, other is by surgical excision. So let's start with the clamps or device methods. So this includes using devices like a Gomco clamp, Plastibell, or a Morgan clamp, etc. So in this approach, the device is actually applied to the foreskin, which helps to control the bleeding and allows the surgeon to remove the foreskin in a more controlled and standardized manner. And we also have the another method, that is surgical excision, the second technique. So in surgical excision, this is completely different approach, and here the procedure is actually performed manually using the instruments such as scalpel or surgical scissors rather than relying on a clamp or device. So this method is often referred to as a free hand or a sleeve technique, where the foreskin is carefully cut, removed, and the area is sutured. All right, so that's about surgical excision. So I hope it's very clear regarding the difference between a surgical excision and circumcision using a clamp and device. Let me know in the chat, coders, because that is very important, because on the basis of that these codes are classified. All right. Okay, so if you understand this concept properly, circumscription questions become one of the easiest scoring areas on the exam. So when you look at these codes, these are the codes for the primary circumcision. Don't try to memorize them. Instead, just think through the logic. So first, whenever you see a circumcision question, first question you should ask is that whether a device or clamp was used. So if your answer is yes, that is your device-based circumcision, typically performed with a dorsal penile or ring block. Okay, and you would code them with the CPT code 54150. So you can see the code description. 54150 is for the circumcision using clamp or other device with regional dorsal or dorsal penile or ring block. All right. Now, there is an important thing to remember while coding 54150. There would be cases you would see that circumcision will be performed using clamp or device, but there won't be use of any dorsal penile or ring block. So there will be no those such anesthesia used. In such cases, you would report 54150 with a 52 modifier. So you can see that in the parenthetical guideline, report 54150 with 52 modifier when performed without a dorsal penile or ring block. Okay, all right. Now, if the circumcision is performed by surgical excision other than the clamp, device, or dorsal slit technique, that's when you use a CPT code 54160 and 54161. And these codes are classified based on the age of the patient. So if a surgical circumcision is performed on a neonate, means a baby who's 28 days of age or less, then you would use a CPT code 54160. And if the surgical circumcision or excision, a surgical excision circumcision is performed on anyone who is older than 28 days of age, then you would use 54161. All right. And also, once again, you also have to remember that you should not report the CPT code 54150 and 54160 with a 63 modifier, which is for the procedure performed on infants less than 4 kg. So remember, do not append a 63 modifier with CPT code 54150 and 54160. All right. So yes, so we have another sets of circumcision codes. Okay, so let's take one step further and look at what happens after the initial circumcision procedure, because in real practice, even on the exam, you won't always see the fresh or initial circumcision cases. So sometimes a patient will come back with a complication or incomplete procedure, and that's where these codes comes into play. Now imagine if a patient had already had a circumcision done, but later develops a adhesion, meaning the tissues are abnormally stuck together. And in that situation, surgeon will go in and perform a lysis or excision of those adhesion. And that's when you are going to report the code 54162. Okay, and in some cases the original circumcision was not done completely and properly, and the surgeon or the patient might require a revision to correct it. And that's when you will code for the CPT code 54163. So 54163 is for repair or incomplete circumcision. Okay. And we have another CPT code that is for frenulectomy procedure. Sorry, that is for frenulectomy procedure, which involves release of the frenulum. And important thing which you have to remember is that if you have a frenulectomy procedure done along with the circumcision, you won't report them together. You can see that in the parenthetical guideline, do not report 54164, which is a frenulectomy code, with the circumcision codes 54150 through 54161, 162, and 163. Okay, so in such cases, you might report a more comprehensive procedure that would be circumcision. All right, so let's move on. And okay, let me summarize the circumcision procedures or circumcision coding. So for the primary circumcision, whenever you receive a scenario, ask this question: was the procedure or the circumcision performed using a clamp or device? If it is used as with a clamp or device, you would assign code 54150. If it is not using clamp or device, rather than we use a surgical excision, then we can move on to the code 54160 and 54161, which is differentiated based on the age of the patient. Okay, and also don't forget to assign a 52 modifier along with 54150 if dorsal penile or ring block is not used. All right, coders, how are you all feeling? Let me know in the chat. Did the explanation help so far regarding the circumcision procedure? Type it in the chat. Okay, let's make it interactive because we are moving on to coding exercise. Okay, great. Awesome. Awesome. Okay, awesome. All right, so let's do some exercise. Here we go. Of the following answers, which best describe the correct CPT coding for this procedure? Options are option A, 54150, option B, 54160, option C, 54161, option D, 54150 with a 52 modifier. A 2-year-old male newborn undergoes elective circumcision prior to the discharge. The physician discussed anesthesia options with the parents, and a dorsal penile nerve block is administered using 1% lidocaine. The procedure is performed using a Gomco clamp with the foreskin dilation, adhesion, removal, devascularization, and excision of the foreskin. Patient tolerates the procedure well. Okay, coders, you got 2.5 minutes. I'm sure that you will answer before that 2.5 minutes ends because that's what you have been doing whole day now. Okay, your time begins now, coders. Okay, that is almost time. Anyone to place answers in the chat? Yes. Give your best answers. Don't worry even if you get it wrong, Goddess. Give your best answers. Okay. All right. So let's go ahead and let's solve the scenario. Okay, so we have here a patient who's here for circumcision, and circumcision was performed using a dorsal penile nerve block and a Gomco clamp. Okay, it was done using. So first question which we had to ask is that whether we had a device or a clamp used, and the answer to that question is yes, right? So we had a Gomco clamp used and a dorsal penile nerve block were also used. So these are our MCG FTRs, the facts to remember. So we have simplified all these guidelines into our MCG manual, and if you have your MCG manual, you can find it in the under the male genital system chapter. So you can see the circumcision guidelines. We have simplified and placed them there. 54140 is to 54150 is to be used when circumcision is done using a clamp or other device with nerve block, and 54160 is used when circumcision is done or circumcision excision for neonates without clamp or device. And then we have 54163, that is for revision circumcision, and 52 modifier will be used along with 54150 when circumcision is done without a nerve block. Okay, so that is our MCG manual FTRs. All right, so let's solve the scenario. So 54160 is coding for a circumcision surgical other than clamp, device, or dorsal slit. We did had a procedure. We had a procedure actually performed using a clamp, right? So this is wrong. So 54160 is wrong. 54161 is also wrong because that is having the same padding code, and age of the patient is 2 days old, male born, newborn, right? 54161 is to be used for patient who's older than 28 days of age. So this one is double wrong. Now we are left with option A and option D. Both are coding for the same CPT, which is 54150, which is for circumcision using clamp, other device with regional dorsal penile or ring block. Now, 52 modifier has to be only used when the procedure is performed without dorsal penile or ring block. Also, we had a dorsal penile block used here. That means no need to assign 52 modifier. The correct answer is going to be option A, 54160. Okay, so all of you have went just scrolling through the chat, and I can see only alphabet A. Excellent job, coders. Let's move on. Let's do one more scenario here, the circumcision. Of the following answers, which best describe the correct CPT coding for this procedure? Option A, 54150, option B, 54160, option C, 54160, 52 modifier, option D, 54150, 52 modifier. A 15-year-old male infant brought for circumcision. Surgeon initially considered using a Gomco clamp, but ultimately performs the procedure using freehand surgical excision without any clamp, device, or dorsal slit. The procedure is completed successfully. Of the following answers, which best describe the correct CPT coding for this procedure? And coders, your time begins now. Okay, I can see some answers are already in the chat. Great. All right, I can see a lot of answers in the chat coming. Okay, great, great. So as I said, you didn't need that 2.5 minutes. You all are rocking it in the chat. So okay, I will walk you through this one. You all are nailing these code circumcision procedure coding. All right, so what do we have here? We have an inventory circumcision done and was a surgical excision, right? Initially, the physician did consider about the Gomco clamp, but he later decided that he would use a freehand surgical excision. Okay, so no clamps or device used here. So option 54150 is incorrect. Okay, and option A and option D is wrong, so we are left with option B and option C, both are coding for 54160, which is for circumcision surgical other than surgical excision other than clamp, device, dorsal slit, neonate, age 28 days or less. So age is correct. We had a patient with 15 days old. Sorry, we had a 15-day-old patient, so age is also right. Now, should we use a 52 modifier here? Because I don't see any, because I can see any anesthesia used or regional or penile block. So shall we use a 52 modifier? Let me know in the chat. Let me know in the chat, code. Shall we use here? All right, we cannot use because the guideline, the parenthetical guideline was specifically for 54150, not for 54160. So only if uh, anesthesia, I mean, only if a dorsal penile or ring block was not used, we would report 54150 with a 52 modifier. So it does not apply for 54160. That means option C is wrong and option B is the correct answer. 54160. So don't fall into such traps, coders. So always have your forensic eyes open while coding for circumcision. Since these are easy picking, small questions, you might have that temptation to answer quickly and go. So, but I will always say, recheck them. They're easy and don't miss out opportunity to get a correct answer there. Okay, so let's move on to the hand pole scenario and let's do some revision on what we have learned so far. Okay, so this is a hand poll. You can type your answers in the chat. Here we go. What defines a supracervical hysterectomy? Does that mean removal of the uterus and cervix? Option A. Option B, does that mean removal of the uterus only, where cervix is left behind intact? Option C, removal of cervix only, or option D, removal of the uterus and ovaries. What say you, goddess? A supracervical hysterectomy. Okay, I will give you a hint. Otherwise, it's also known as subtotal hysterectomy. Okay, great, great. All right. Okay, I call this session a rapid fire session. So type your answers in the chat fast. Okay, yes, option B is the correct answer. A supracervical or subtotal hysterectomy means it only means that the uterus will be removed and the cervix will be intact. Next one, which of the following is true regarding vaginal hysterectomy coding? Option A, weight of the uterus is not considered. Option B, same code used regardless of the weight. Option C, codes differ based on whether the weight of the uterus is 250 grams or less or 250 grams or greater. Weight applies only in laparoscopic procedure. Which of the following statement is true regarding a vaginal hysterectomy? Okay, all right, great. Oh, awesome. I am so happy to see the answers. I'm super proud. Excellent job. Yes. We have three approaches. We have abdominal approach where the codes are not classified based on weight, right? It is based on the complexity and extent of the procedure. The next one is a vaginal approach. In vaginal approach, yes, the codes are classified based on whether the weight of the uterus is on the upper side or lower side of 250 grams. Excellent job. Yes, option C is the correct answer. And we are moving on. Next question. Which factor is most important when selecting hysterectomy code? Option A, patient age. Option B, surgical approach. Option C, type of anesthesia. Option D, length of the surgery. which is most important while selecting a hysterectomy procedure? Unbelievable. You all are fantastic. Yes, it is option B, surgical approach. Great job. Next one. Which of the following indicates a radical hysterectomy? Option A, removal of the uterus only. Option B, removal of the uterus plus tubes. Option C, removal of the uterus plus lymph node dissection. Option D, vaginal approach. This one must be an easy one. Let's say you go this. Absolutely correct, Miss Mills. They are killing it. Yes. Yes, it is indeed. It is option C, removal of the uterus with lymph node dissection. So it's a radical procedure, right? So it also involves surrounding tissues. Great job. Next one. Which of the following factors are determines the correct circumcision coding? Option A, gender of the patient. Option B, surgical technique with age. Option C, operating time. Option D, diagnosis only. What say you, coders? Which of the following factors determine the correct circumcision coding? Mhm. Yes, as I said previously, you have to see the technique, whether the clamp or it was a surgical excision. Also, age also plays a factor, right? Yes, option B is the correct answer. Superb. Okay, next one. Patient undergoes a correction of incomplete circumcision. What is the correct CPT code? Option A 54161, option B 54162, option C 54163, option D 54164. Correction of incomplete circumcision. I think we'll have to open your CPT manual maybe. Okay, so you all are still answering so quickly. Absolutely. It's option C 54163. That is for correction or repair of incomplete circumcision. Fantastic job, Codus. All right, so next question. I think this is the last handful question. A circumcision performed along with a frenulectomy. How should be how should this be coded? Report circumcision plus 54164, which is a frenulectomy procedure. Report only 54164. Report circumcision only at modifier 59. What say you, Codus? Frenulectomy procedure. The last CPT code which we reviewed under the circumcision. And the guidelines say that you should not report a frenulectomy with a circumcision, right? So circumcision is a much comprehensive procedure, and the frenulectomy is actually included in the circumcision. Okay, so we will report for the much more comprehensive procedure. That would be circumcision. Yes, option C is the correct answer. Excellent job. Excellent job, Codus. How did you do today? Let me know in the chat. So are we good with the hysterectomy and the circumcision guidelines? Are we good? Okay, I'll just wait. Okay, is the concept clear? So don't miss out an opportunity to score on those questions. And coders, if you feel like you need more practice or want to visit today's concept, head over to our AMCI channel. Inside the channel, you will find dedicated playlist that is for CPT guideline mastery. We have a lot of other playlists as well. Please feel free to check each one of them, and they will be definitely useful for you, if especially if you're preparing for your certification. Okay, so under the CPT mastery guideline, you will find all our previous recording where we have broken down similar topics as we took today. Okay, and take your time, go back, rewatch, reinforce and understand, and reinforce your understanding. And I truly hope all these videos will be helpful in strengthening your coding skills and boosting your confidence. Okay, so once again, I am humbly requesting you all to please take a moment to fill out the survey form which I have shared. You can also let us know which topics you are looking forward to in the upcoming session, because I did review the previous week's survey form, and most of you have mentioned some of the classes or some of the topics you should allow to see from here from us. So yes, we will be looking into those topics as well. And coders, this feedback really help us to plan the content, and also that will be useful for you. So feedback is extremely important, because only when you share it with us, we are able to come back with more sessions and videos tailored for your needs. Okay, so don't forget to share the feedback with us. I've once again placed a link into chat. That's all we ask. And also, if you enjoyed the video, if you enjoyed the content which we gave today, smash that like button, subscribe to our AMCI channel, and share these videos with someone who would really need to see them. Okay. All right, coders. With that, we come to a conclusion of this week's CPT Guideline Mastery session. We will be back with another one next week. Until then, stay safe, keep coding, and also don't forget to fill out the survey form. Okay, so see you all next week. Till then, take care.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around.